I'm in the hospital in the cath lab with young man, 26 years old. He's a heavy smoker with heart attack. In the angiography, what I found out that he has one artery, it was blocked. I have done the angioplasty, opened the artery and restored the blood circulation. Later, I have discussion with my colleague. How such a young man has heart attack so early? And well, said, of course, he is a smoker, heavy smokers, and this is the reason. I said, but he is a smoker for all the arteries. How come only one artery is blocked and all the others are normal? So we have no answer for this. When he was recovering, I went to the patient and asked him about what happened with his wife 4 years before this. And he told me that he has a problem with his wife because his wife families accused him to be impotent because they want to have children without success. And his wife said, yes, he is impotent. And this hurt him so deeply that he built a wall between him and his wife. Even though later they had children, but this crisis is still there. And this crisis that influenced this artery that's related to this kind of crisis. 23 years of research and clinical experience led me to the conclusion that for every emotional crisis, there is address in our body. And I developed a method that connects between these aspects together in order to prevent the disease, resolve the crisis, and in order to restore the state of well-being. So today, everybody that has a disease, from the disease we can understand the crisis. And we can understand why in some people, for example, after the crisis, they can have gastritis, and others they can have a gastric ulcer, and the third could have cancer. Why? Because for every crisis we have addressed, and the way that we express our crisis will determine the kind of the disease. This is very important because we come back to the same definition that the World Health Organization defined health as a complete physical, mental, and social well-being, and not merely absence of disease. And the method that I developed exactly to obtain this. And that's what I want to tell you about in my talk.